Shortness of breath, also known as dyspnea, is a sensation of difficulty or discomfort when breathing. It can range from mild to severe and may be temporary or chronic. Shortness of breath can have various causes, and it is essential to determine the underlying reason to address it effectively. Here are some common causes of shortness of breath. Physical exertion. Shortness of breath during physical activity, like exercise, is normal and often referred to as out of breath. It typically improves with rest. Respiratory infections. Conditions like the common cold, flu, bronchitis, or pneumonia can lead to shortness of breath due to inflammation and mucus production in the airways. Allergies. Allergic reactions can cause airway constriction and lead to difficulty breathing. This can occur in response to allergens like pollen, dust, or animal dander. Asthma. Asthma is a chronic respiratory condition characterized by inflammation and narrowing of the airways, resulting in recurrent episodes of shortness of breath, wheezing, and coughing. Chronic obstructive pulmonary disease, COPD. COPD encompasses conditions like chronic bronchitis and emphysema, which progressively restrict airflow and cause chronic shortness of breath. Heart problems. Various heart conditions, including congestive heart failure, coronary artery disease, and arrhythmias, can result in reduced oxygen delivery to the body, leading to shortness of breath. Anxiety and stress. Emotional factors can cause rapid breathing, which may mimic shortness of breath. This is often associated with panic attacks or generalized anxiety. Obesity. Excess body weight can put pressure on the chest and lungs, making it more challenging to breathe, particularly during physical activity. Smoking. Smoking damages the lungs and can lead to chronic respiratory conditions, increasing the risk of shortness of breath. Environmental factors. Exposure to air pollution, high altitudes, or extreme weather conditions can trigger shortness of breath in some individuals. Anemia. Low red blood cell counts can reduce the amount of oxygen transported in the blood, leading to a feeling of breathlessness. Other medical conditions. Some other conditions, such as interstitial lung disease, lung cancer, and certain autoimmune diseases, can cause shortness of breath as a symptom. The treatment of shortness of breath, dyspnea, depends on its underlying cause. Identifying and addressing the root cause is crucial for effective management. Here are some general approaches to treat shortness of breath. Oxygen therapy. In some cases, supplemental oxygen may be necessary to increase oxygen levels in the blood and alleviate shortness of breath. This is often used in individuals with advanced lung or heart disease. Breathing exercises and techniques. Pursued under the guidance of a healthcare professional or respiratory therapist, breathing exercises can help improve lung function and reduce shortness of breath. Techniques like pursed lip breathing and diaphragmatic breathing can be useful for individuals with chronic lung conditions. Lifestyle modifications. If you smoke, quitting smoking is essential for improving lung health. Weight management may be recommended for individuals who are overweight or obese, as excess weight can exacerbate shortness of breath. Regular exercise, when appropriate and prescribed by a healthcare provider, can help improve cardiovascular fitness and reduce shortness of breath during physical activity. Medications. Bronchodilators, such as inhalers, can open up airways and ease breathing in conditions like asthma and COPD. Corticosteroids may be prescribed to reduce inflammation in the airways. Medications to manage anxiety or panic attacks may help if emotional factors contribute to shortness of breath.